تمام هسه اوكي.
هسه اوكي دكتور.
اوكي. بسم الله الرحمن الرحيم. الساعة 9 صباحا يوم 28/4/2021. على بركة الله نبدأ بالمحاضرة الثانية للأورال ميديسين، واللي تشمل فرع الأورال ميديسين وتشمل باقي الفروع الأخرى. أول دقائق راح نستعرض ملخص مفيد إلى المحاضرة السابقة اللي تكلمنا عليها بالأسبوع الفات. هذه المحاضرة السابقة تكلمت البيسك principles of the oral medicine, and it is considered to be as an introduction to the oral medicine, and we have been emphasized on the following. We have been emphasized about what we mean exactly by the oral medicine, what is the benefit of studying the oral medicine, what are the fields that we are concerning about in oral medicine, and we go further related to the oral mucosal lesion, whether it was white and red or any ulcerative type of lesion, and we know that the facial pain, the temporomandible joint, the salivary gland, the autoimmune disease, all it's considered to be as the scope of action of the oral medicine. And we have an idea that the oral medicine, it's have a great relation between the systemic disease and between the oral manifestation, how it is going to be considered sometimes the primary diagnosis of the systemic disease, or how the systemic disease is going to be manifesting in the oral cavity. This is the main aim of our study of the oral medicine. And we go further regarding that. And we have a statement or information. In order to make an accurate diagnosis to the patient, we have to concentrate on two most important things. First of all, the history. And we have studied the basic principles of the history of the patient and the type of the question which is going to be applied for each patient when we are going to be applied the question to the patient, whether it was open question or another types of a question. And we go further regarding the examination of the patient. And the most important things that we are going to be emphasized in this lecture and the other lecture is the extra-oral examination and the intra-oral examination. After finish the history, we go further regarding the extra-oral examination and the intra-oral examination. And also, we classify the types of the patient that we have to deal with, whether he is controlled, whether he is poorly controlled, the type of the systemic diseases which is going to be influenced the way that we are going to apply the different modalities to the patient. So today we are going to continue regarding the examination of the patient. So as a general talking, we know in order to make an accurate diagnosis to the patient, we have to examine the patient before the patient is going to sit on the dental chair. And we study regarding the abnormal types of movement of the patient, what are the most causes of this, and what are the causes of abnormal smear, for example, of the patient, abnormal types of movement, and so on, and related these abnormality to many systemic diseases. Actually, we could not make an accurate diagnosis, but it may give me clue that this patient may need a further investigation in order to manage him. And this may give me clue that these considered to be as a diagnostic features of the patient. So today, we are going to continue the lectures and we are going to talk about the extra-oral examination. Continue to the extra-oral examination. So what about the specific diagnostic feature for the dentist? I choose to put that the jaundice is considered to be the most important things that should be noticed by the dentist. And here it is going to be representing as a yellowish of the skin and yellowish of the sclera. And we know that there is too much waste product of the body naked when a breakdown of the red blood cell. And sometimes this may relate it to the liver, and sometimes it may relate it to the viral infection, like for example, the hepatitis or mononucleosis, or sometimes it may not relate it to the viral infection. Sometimes there was a gallbladder or pancreas or alcohol abuse and so on. So as a general talking, yellowish of the sclera considered to be as one of the diagnostic for the patient, taking into consideration that the age of the patient may play a great role in the way that we could investigating those types of patients with yellowish of the sclera. That is to say, as I say, within the affecting of the age, when I'm dealing with a patient who is complaining from yellowish of the sclera, for example, he is a young age, I am going to direct it my mind toward the viral infection, and I'm going to say in the patient for viral hepatitis, for example, and we are going to investigate in the laboratory, and we know how to make that. Then after that, if I'm going to deal with an old patient or geriatric patient, I suppose that the gallbladder or stone or sometimes any enlargement which is going to be affected the secretion of the bilirubin may cause the jaundice. Like for example, pancreatic or gallbladder, sometimes stone, or sometimes either the cancer, hepatocellular carcinoma, may cause yellowish of the sclera. Another important thing that we are going to deal with during the extraoral examination is the source. And sometimes this source is going to be representing around the lip, and the viral infection considered to be the cause, like for example, the herpes simplex virus. And this may give me indication that the patient, for example, he is immunocompromised, or sometimes there is hormonal changes, or sometimes it is going to be manifesting of other systemic disease if the patient is complaining from recurrent sores or recurrent ulcers, and so on. Another diagnostic features which should be well recognized by the dentist is the presence of the butterfly rash. And here we have to take this as a serious condition. And it is usually representing on both cheek in the shape of the butterfly rash, مثل ما راح نشوفها بالfacial characteristic features. Sometimes it is considered to be as a sign of systemic lupus erythematosus, of SLE. This means that the patient may complaining from autoimmune disease, and sometimes he is under treatment of immunosuppressive drug and need a specific modification before we are going to be applied any type of treatment. And here, sometimes the butterfly rash may associate it with oral ulceration and specify on the palate. Sometimes the patient may complain from joint pain. In addition, he may complain from fever, and sometimes finger turn blue due to the cold. So I'm going to summarize. Yellowish of the sclera is considered to be as important. Soreness and the butterfly rash also. Another diagnostic feature is the hair. Sometimes it is going to be represented in an unusual place. Sometimes dropping of the eyelid during the examination of the eye. We are going to take it into details when we are going to take into consideration the examination of the eye of the patient. And even in the severe cases, the eyelid may block the vision. And those types of patients may complain of ptosis. Sometimes it is considered that a serious condition of those types of patients, and there is a problem within the brain, in the nerves, or sometimes in the orbit, in the eye socket. And here the patient may complain from double vision, weakness of the muscle, even though patient with a myasthenia gravis may complain from trouble with swallowing or bad headache and so on. Another important thing that we have taken into consideration is the facial palsy. Sometimes it may relate to the virus condition, and most of the cases like that, and sometimes it may relate to the serious condition. If especially it does not getting within normal, within that is to say, after giving the treatment. So what I want to give an idea that any facial paralysis which does not respond to any type of a treatment, please try to investigating those types of patients, because sometimes any tumor is going to be representing on the parotid gland, and we have seen many cases regarding that from the practical point of view. Patient who does not respond to any type of a treatment of the facial palsy need further investigation. And in our practical life, we have been demonstrating some patient who is complaining from facial palsy who does not respond to a treatment. And actually there was a large, for example, of the lymph node which is surrounding the facial nerve during its past, or sometimes the swelling which is occur inside the parotid gland in which the facial palsy is going to be passed. So please, for your do not ignore facial palsy who do not respond to any type of treatment. وهناك الكيسات كثيرة لاحظناها في حياتنا إنه those types of patients may have a serious condition rather than facial palsy due to the viral infection. Another symptoms that we have to demonstrating is the facial paralysis, or sometimes that is to say the facial movement. And we have to know that the facial movement is usually under the control of the nervous system, and sometimes it may give me indication that there is a lesion occur along the distribution of the facial nerve, and it is going to be represented as hypertonicity or hypotonicity of the facial muscles. And sometimes the upper motor neural lesion and the lower motor neural lesion also. Either facial palsy or sometimes facial paralysis, or sometimes abnormal type of movement of the face. Again, sometimes the patient may attend to us complaining from numbness or weak on the face, and it's may associated with slurred speech, double vision, and sometimes he may complain from trouble swelling, and this may occur due to the lesion occur along the distribution of the facial nerve. Another important diagnostic feature which should be taken into consideration when I'm going to deal during the extraoral examination is the presence of the yellow spot on the eyelid. These yellow spots or yellow bumps around the upper and the lower eyelid, which is called the xanthostomia, may give me indication that there is abnormal level of the cholesterol, and sometimes it is considered to be as dangerous, painful, and may give me indication that the patient may have a heart disease or is susceptible to develop the heart attack. Look, the relation between the heart disease and between the yellow spot on the eyelid. Another diagnostic feature during the extraoral examination is the presence of the puffy eye. And here, the space below the eye can fill with the fluid, and it is going to be look swelling or puffy. And sometimes too much salty fluid or hormonal changes may lead to the above condition. Or even though allergic conditions sometimes, or the patient may have allergy or insect bite, those patients may complaining from puffy eye. Another manifestation or another diagnostic feature during taking in the extraoral examination is the melasoma. And here it is going to be representing as a gray-brown patches of the skin. Sometimes it may occur after pregnancy, consider one of the causes of it. And sometimes control pills or contraceptives. Sometimes it is going to be disappear, and sometimes it's going to be persisting even after pregnancy. Another things to be demonstrating is the hair loss and hair we could demonstrating the present of the alopecia areata, which could be divided into partial or totalis, تنقسم إلى قسمين, and here may give me indication that the patient may complaining from an autoimmune disease, which is autoimmune disease, and we have to investigate for that. Another things which is going to be demonstrating during the extra examination is the facial characteristic. What I mean by the facial characteristic, during the extra oral examination of the patient, sometimes we could demonstrating some of the facial characteristic. راح نتكلم في هذه المحاضرة وفي نهاية المحاضرة الأولى على قسم من الفيشل characteristic that it could be considered as a preliminary in the diagnostic of the dentist. Carinal parkinsonisms, which is usually appear in the elderly patient, and here we could demonstrating that the rigidity of the facial muscles gives a characteristic immobility of the face. ونسميه بالparkinsonism face, and we could demonstrating that the expression is fixed, and here the patient may have starring, star of the eye, blanking, infrequent of the mouth is open, slightly open, and saliva sometimes may dropping from the mouth. And even though the patient may complaining from angular stomatitis because of the dropping of the face, or sometimes during asking of the patient, he may complaining from difficulty in swallowing, that is to say, the dysphagia. And sometimes the patient may complaining from facial paralysis. هذا الستارة of the eye and the rigidity of the face or decrease of the mobility or dysphagia, it is considered to be as a characteristic features of the face of the patient. So here we could demonstrating some of the characteristic features of the faces, which is may give me an idea about this patient is actually complaining from what we say from facial characteristic features, which may give me an indication. So here we could demonstrating the presence of the hypocritic faces, other hypocritic faces. Here we could demonstrating that the eye is considered to be as a sagging eye, but we could demonstrating that it is bright. The nose is punched, and the crust on the lips sometimes we could demonstrating, and even crusted on the tongue. And during examination we could demonstrating that the tongue is dry. Sometimes we could demonstrating here in this picture the face of the myasthenia gravis. We could demonstrating rapid exhaustion of the muscles, particularly in the face. And here we could demonstrating dropping of the jaw. Look here, dropping of the jaw, and the patient sometimes need his hand in order to close his mouth. This is the hypocritic face. And the most important things that is may give me an alert during the diagnosis, here we consider the spider nevi. This what we call it, the spider nevi, which is considered to be very important. This is spider nevi or pleural spider nevi, which is considered to be as a type of telangiectasia. And here there will be swelling of the blood vessels found slightly on the skin surface. And it is usually present as a central red spot, as we are demonstrating, reddish extension, and it is sometimes may associated with the spider webs. Spider nevi is very important, which is characterized by dilatation of the blood vessels, and it is sometimes spider veins or angioma. A spider nevi is a collection of diluted artery, small blood vessels to the surface of the skin, and it may give me indication that this patient is complaining from impaired in the liver function test. Sometimes he's considered to be as alcoholism, or he need a further investigation. And sometimes it's not related to that. And there are many factors, like, for example, this patient exposure to the sun, for example, or even the injury, or sometimes there will be hormonal changes. And the most important things that we have to investigate with the spider nevi is the involvement of the liver disease. Another cause of the spider nevi, أنا أركز على spider nevi. I'm concentrating on this because misdiagnosis of these characteristic features is considered to be as a serious to the dentist, and this patient may have a lot of estrogen in his system, and sometimes chronic liver disease is associated, or sometimes the patient is complaining from a serious liver disease, and therefore investigation of the liver مثل ما راح نشوفها بالمحاضرات القادمة, how we could investigation the liver is considered to be as an important. And sometimes even though even obesity is may consider the cause, but sometimes it's considered to be as a serious disease. Here we could demonstrating the presence of a butterfly rash that I have mentioned before, which is representing on the cheek, butterfly rash. مثل ما قلنا, sometimes it may associate it with a serious condition. Sometimes it may give me an indication that mitral stenosis, and this patient may complaining from stenosis, mitral stenosis, and therefore investigation is required. Or even though sometimes the patient may complaining from systemic lupus erythematosus, اللي هو مثل ما قلنا ال SLE أو ال DLE, systemic lupus erythematosus, or even though rosacea or any other dermatological disease is considered to be as important. Another investigation, that's what we call it, the Down syndrome. Okay, the Down syndrome sometimes we could demonstrating, which is considered to be as important. A Down syndrome, here there will be slants of the eye. That is what we call it, the Down syndrome. Eye multi. Down syndrome, or what we call it, the mangolism, trisomy. Here there will be upward slant of the eye. Look, the eye, upward slant of the eye in this area. And position of the bile air should be observed. Here we could demonstrating that. Should be observed with a line drawn through the centrals of the eye. Depressed in the nasal area, protruded of the tongue. Here we could demonstrating this, what we call it, the pear ripper syndrome, narrowing of the jaw. And in this types of patient, usually pear ripper syndrome has difficulty in swallowing, and sometimes may have a suffocation في بعض الأحيان, backward position of the tongue. Also could be demonstrating. And here also we could demonstrating the presence of what we call it, the presence of the hair in unusual position. Here we could demonstrating that, and it's considered to be as a female, and hair may give me indication that the patient is complaining from viral phases, and mostly women, they are complaining from hyperplasia or tumor of the adrenal cortex. Look, just representing of the hair in this area, or mustache, or beard sometimes in the female, it may give me indication that the patient may complaining from hyperplasia or tumor of the adrenal cortex. Carcinoid face and so on. These are the most common faces which characteristic features which is considered to be as important to the dentist during the extra-oral examination. Again, the abnormal color of the face, مثل ما قلنا الميلانين, and في كثير من الأحيان it may associate absence of melanin, presence or absence of melanin in the melanosomes, in the melanocyte, and melanin in the keratinocyte that is responsible for the epidermal pigmentation. And sometimes here we could demonstrating the Addison disease, especially if the patient is complaining from hypertension and hypoglycemia. The patient may associate it with pigmented on the oral cavity, where we have demonstrated cases or many cases, some cases of Addison disease, and they have no other sign or symptom, just the presence of the oral pigmentation or increase in the melanin in their oral cavity, and the patient complaining from time to time from loss of consciousness and fatigue and the level of the hypertension, but the oral manifestation was fair enough in order to make a diagnosis. مثل ما تكلمنا أيضا yellowish of the skin, also brownish or earthy in color. هذا عندنا our philosophy during dealing in a patient with earthy color. Earthy color احنا بالنسبة لنا يعني كلش بعد البروجنوسيس، واذا نحب نحكيها by the onward يعني بعد البروجنوسيس بداية تآلف الإنسان ويا التربة. And mostly occur in a patient who is complaining of impaired in the kidney function test, or patient with cachexia, with metastasis of the tumor. He is going to be started as an earthy in color, which is considered to be as alerting during the examination. Okay, as العفو هذا the first lecture خلصت. الآن we are continue the lecture regarding the extra oral examination. ما مطلوب من عندنا لخصناه بهذا السلايد. What we are required from the extra oral examination: in facial characteristic features. Sorry. Here we could summarize exactly what we are going to be required from the extra oral examination. هذا هو ملخص الfacial characteristic, and we describe more than 8 types of the facial characteristic, and we talk about the facial movement, whether it was a facial palsy, upper motor neuron lesion, lower motor neuron lesion, and if there was any lesion here along the distribution of the facial nerve. And the other most important things, we are going to have some idea about the eye, how we could make a diagnosis, and what is the eye is associated with many systemic disease. And we are going to have an idea regarding the lip, the neck, the lymph node, which is considered to be very important to us. هاي تؤخذ بمحاضرة إن شاء الله وحدها. In addition, the skin and the cranial nerve examination, and the other things which should be noting in the extra oral examination. Here we are going to have some idea about the manifestation of the systemic disease that I have talking in the first lecture. Sometimes it may associate it with a congenital, or sometimes traumatic, or sometimes a vascular disorder. The vascular disorder is going to be representing as hypertension, emboli, migraine, blood dyscrasias, hyperviscosity, and the sickle cell anemia. And sometimes metastatic carcinoma may occur in the oral cavity. And the most important things that we are going to deal in details in another lecture regarding the autoimmune disease. And we concerning about these, like for example, the collagen vascular disease, the ankylosing spondylitis, sarcoidosis, and the temporal arteritis. These are the manifestation of many systemic disease that may have an oral manifestation. In addition to the thyroid, وهناخد بالتفصيل the examination of the thyroid, the myasthenia gravis تكلمنا عليها, and sometimes multiple sclerosis, infection disorder, diabetics, and if the patient is taking any medication, toxin drug, and so on. So we start now for the examination of the eye. What is the responsibility of the dentist during the examination of the eye? Whether the dentist is responsible to examine the eye? Actually, it is not the responsibility of the dentist to examine the eye, but the most important things, there are many oral manifestations, or there are many diseases which may associated with the involvement of the eye. مثل ما راح نشوفها. Sometimes if the patient is complaining, for example, from dry oral, dry in the oral cavity, and we have to ask the patient whether he is complaining from dry eye. This may give me indication that the patient is, for example, Sjogren's syndrome, and the patient may complaining from keratitis or continued conjunctivitis from time to time, in addition to the dry of the mouth. Therefore, I'm going to direct my mind toward the investigation of the Sjogren's syndrome. Sometimes we have to examine the sclera, because the sclera sometimes it is considered to be as a yellow and a jaundice patient, and sometimes it may associate it with inflammatory changes and specify in a patient with rheumatoid arthritis, or the patient may complain from recurrent scleritis. Even though other systemic disease, other disease that may associate it with involvement of the eye, the writer's disease, and here the patient may complain of multiple recurrent oral ulceration in addition to the eye. Symptoms is going to be developed, and the patient may complaining from conjunctivitis. Another disease which may associate it with involvement of the eye that may have an oral manifestation and considered to be as very important, it is the Behçet disease. And here the patient may complaining from recurrent aphthous ulceration persisting for a long period of time. Then after that, another system is going to be representing, and the patient may complaining from conjunctivitis and recurrent inflammation of the eye. إذن صار عندي writer's disease نعددها. writer's number 1, Stephen Johnson number 2, Behçet disease number 3, Sjogren's syndrome number 4. All of these may associated with a systemic disease, and راح نشوف any and we are going to see many other disease that may happen, or Stevens-Johnson syndrome also. We are going to see many of these that may associate it with the eye involvement. Another things that we have to demonstrating on the eye, because the eye may associate it with many systemic disease, specify the diabetic patient. And here the underlying causes of diabetic, the patient may complaining from retinopathy, and we could, and the ophthalmology could demonstrating that there is a microvascular leakage, which is going to be affected the retina, affected the level of the vision, and this could be demonstrating in a patient who is complaining from excessive glucose, which is usually interfere with the normal metabolism of the lens. And sometimes the patient may complain from cataract. This mostly associated with diabetic. And then the most important, first of all, the diabetic. Second, if the patient is complaining from hypertension, sometimes we could not demonstrating the presence of any abnormality, but hypertensive sometimes may associate it with a retinopathy, and this could be may associate it with multiple grade from grade 1 to grade 4. And sometimes if the patient is treated for hypertension, the resolution of retinal changes is going to be occur. And even though the hypertension may cause permanent damage to the vision, because the optic nerve is going to be involved, which is usually the retinal circulation also. And then diabetic, both that I have say and the hypertension, both of them may cause a muscle paralysis, may cause a sequent, may cause a double vision, because both of them, the diabetic and the hypertension, is going to be affecting the nerve of the eye. Another manifestation of the eye, sometimes it may give me indication about the thyrotoxicosis. And here, exophthalmos could be demonstrating, and the excessive thyroid level is usually called the protrusion of the eye. وهذا الدنتست يعني يجب he have to demonstrating whether there is any exophthalmos and symptoms in the eye. It is considered to be before any other systemic features is going to be occur. يعني الاكزوثالاموس يبدأ قبل ما تبدأ any other symptoms. Sometimes it could be bilateral, as we could demonstrate that in a Graves' disease, or sometimes it is considered to be as a unilateral. A unilateral is more a serious condition because it is mostly associated with orbital tumor, and even though sometimes trauma. Another things that we have to demonstrating, the cancer of the eye, retinoblastoma, which is usually evident as a white reflex sequence, and the patient may complain from recurrent redness of the eye, and considered to be as a life-threatening also. So the dentist could make a diagnosis because of the eye, because there are many of the oral manifestations associated with involvement of the eye, or sometimes the eye, it is considered to be as a preliminary before any other systemic is going to be occur, like for example in the exophthalmos. And the dentist could make a diagnosis clinically by use the Nefisigers method, either by standing behind the patient until tilts the head backward and observe the eyeball, whether it is going to be protruded. بالعكس من exophthalmos, there is the enophthalmos, means that there will be recession of the eye, and usually it may occur in a serious wasting disease. ألخص هذه التأثيرات، ألخصها الجوغرين، الرايترز، ستيفن جونسون، البهجت. Another thing that we have to be noticed during the examination of the patient is the examination of the lip. كنا بعدنا بالextra oral examination, and sometimes it may give me indication about the health status of the patient. Sometimes if the patient is complaining from dry crack, sometimes sores or collection of the epithelia is going to be representing associated with serious condition. For example, the uremia, sometimes it's going to be represented as epithelial decrease on the lip, and sometimes it is may associated with the following: actinic colitis and the angular colitis. And here please try to differentiate between these two terminology. بالنسبة إليك الactinic colitis والangular colitis. The angular colitis is considered to be as infection, which is occur at the corner of the mouth, and it is mostly occur. Angular colitis كنا شايفيها cracking of the corner of the mouth, and could be divided into type 1 and type 2. هذا فيما يخص الangular colitis. الفرق انه type 1 it does not involve the mucosa of the buccal mucosa. يعني while the type 2 is going to be extended to the buccal mucosa. Another thing that we have to demonstrating in the examination of the lip is the actinic colitis. And here it is mostly affected the lower lip and associated with atrophic changes. And sometimes it may associate it with erythema or leukoplakia, and we could demonstrating that there will be thickening of the epithelium. Another things that you have to demonstrating, for example, in addition to the angular colitis, هذا هو الangular colitis, cracks occur on the corner of the mouth. Sometimes it's going to be extended here inside, or which is called type 2, and type 1 does not extend it inside the buccal mucosa. Again, another systemic disease which is going to be manifesting on the lip is the anemia, or sometimes even though تباوع تشوف ازرقات بالشفة يعني cyanosis, which is considered to be as hypoxia or decrease in the oxygen supply. And another important thing, in addition to that, it is the Addison disease. And in Addison disease, again, the lip could be demonstrating as a pigmented area. And we know that the viral infection could be representing the herpes simplex virus, herpetic infection. It is going to be represented on the lip. Another thing that we have been demonstrating, or another point during the extraoral examination, we could demonstrating whether the patient is complaining from sweating. This may give an idea either the patient is complaining from hyperthyroidism or increase in the level of the thyroid gland, or sometimes it may relate it to the psychoneurosis, dryness of the skin, also dry skin, and this may give me indication about the patient of the hypothyroidism, or even though the patient is dehydrated. Pigmentation of the skin, مثل ما قلنا Addison disease, or what we call the adrenal insufficiency, which is going to be representing on the skin in addition to the mucous membrane. Again, sometimes excoriation or flashing of the face, like for example in a patient with other systemic disease, like for example hormonal imbalance or sometimes the hyperthyroidism. This is the causes, or sometimes pigmentation. نرجع البigmentation تعتبر كلش مهمة because sometimes it may associate with Addison disease, arsenic poisoning, intestinal malabsorption, cachexia sometimes, or chronic liver disease. Again, we are going some terminology which is considered to be as a very important during the examination of the skin. هذه terminology أرجو أنه تشوفوها أيضا. الماكيولي يعني change in the surface color without any elevation. يعني فقط صبغات، فقط do not evaluating. But the patch here we could demonstrating large maculae equal to greater than يعني 5 إلى 10 ملم. While the papillae is considered to be as circumscribed and solid evaluation. We could demonstrating the presence of the solid evaluation of the skin, and sometimes it does not representing with any fluid. And another thing is the plaque, broad papillae تكون larger, or confluence of papillae equal to greater more than 1 centimeter. The another things that we have to do is demonstrating the presence of the nodules والتي تشبه إلى حد. It is going to have a similar to the papillae, nodules or papillae, لكن السايز مالتها يكون greater more than 1 سنتي. التيوما، الفيزيكلز، هي تعتبر الفيزيكلز شنو هي؟ مثلا بالهيرباتيك هي small blisters what containing a fluid, and it is usually less than 5 إلى 10 ملم. هذا الفيزيكلز. While the bullae, هذا plasters. While bullae it is considered to be as a large plasters. The pastulate is considered to be as a small elevation of the sink containing cloudy or pus. فمن is a pustule. Cyst هو الepithelial lining, will contain a fluid erosion, discontinuity of the skin, and the ulcer, any breakdown of the oral mucosa, we could demonstrate it like that. And the fissure is considered to be as crack in the skin. And sometimes we could demonstrate the presence of telangiectasia, enlargement of the superficial of the blood vessels, and even though the burrow appears as a slightly evaluated grayish tortuous line in the skin. Another lesion which we could demonstrating is the scale-like structures, which is usually gray or grizzly, limited mass of keratinine. Another things that we could demonstrating also crust, liquefactions, excavation, sometimes may associated with punctate or liner abrasion. هذه المصطلحات الطبية اللي ممكن نشوفها في حياتنا، ومثل ما راح نشوف بالاورال ليجنز كل واحدة من عندها تعطيني indication. مثلا الاتروفي mean loss of the tissue. Sometimes this loss of the tissue may occur in the epidermis or in the dermis, while the macuration is softening or turning white of the skin. Again, we could demonstrating another discord figurate, which is considered to be as a particular shape. This is considered the most important characteristic features of the skin lesion. هذه المصطلحات أرجو أنه يتم الانتباه عليها. تبدأ بالماكيولي، البابيولي والبلاك، كل واحدة تعطينا indication اللي يفيدني بالdiagnosis مالتي. After examination of the skin تبقى عندي نقطتين: examination of the thyroid gland and the examination of the lymph node. بالنسبة للexamination of the thyroid gland, we have to inspecting of the neck, but as a general talking, the physical examination of the thyroid or not, we have to palpating of the radial pulse, look at the patient, and then the patient may have a diagnostic, pathogenic diagnostic feature that's need a further investigation of the patient. And we have to evaluating the thyroid gland, whether the patient may have a goiter, or the patient may have a hyperthyroidism or thyrotoxicosis. And here we have to determine the size of the thyroid gland, or even though we could palpating the thyroid mass to see during palpation whether there is cystic enlargement, whether there is a soft, whether it is considered to be firm or hard constituting of the thyroid. And in addition to the examination of the thyroid, so examination of the thyroid itself, هذا هو المبدأ الرئيسي. We could not make a diagnosis. Together with the examination of the thyroid, you have to examine another things which is located not in the thyroid area, like for example examination of the tachycardia, the exothalamus. All of these tachycardia, whether there is a tremor, whether there is a flashing face, agitation of the face, with the enlargement, with another investigation that we are going to discuss, we are going to see whether the patient is complaining from hyperthyroidism or enlarge of the thyroid gland, or further investigation may need in order to demonstrating whether this is considered to be as a benign enlargement, or whether it is considered to be as a malignant or as an autoimmune disease, like for example the Graves. But a general talking, here we need to be gentle in the palpation and very care in detecting if there is any abnormalities occur in the thyroid gland, or we could demonstrating if there is any tracheal deviation. And all the area of the neck also should be examined through inspection, palpation, and the most important things during the examination of the neck. And we are going to stand in front of the patient and palpating the neck from the behind, as we are going to see in this picture. And the other area should be carefully to see if there is any enlargement during the examination. Please try to put these in our mind when we are going to examine the thyroid. أرجو أن تنتبه على هذه النقاط بالexamination of the thyroid. When we are going to palpating the thyroid gland, any nodule on the gland, any nodules is going to be representing by our finger. We are going to ask the patient to swallow saliva or small quantity of fluid repeatedly during the examination. In a normal thyroid gland, it is rarely palpable. Any nodules of the neck near the area, high noctania, or near the area where the thyroid gland is going to be representing, which is going to be moved with the debilitation, can be said to constitute a part of a primary pathology of the thyroid. Then, palpating of the enlarged thyroid, palpating of the nodules, ask the patient to swallowing, and also we have to examine the isthmus, the pyramidal loop, and if there is, the patient is complaining from generalized glandular enlargement. Either the constitution of the thyroid, and whether it is cystic, solid, thyroid nodules, all of these should be noticed, or the or presence of any fluid content. All of these may give me indication whether the patient is complaining from cystic changes, whether the patient is complaining from enlarged, and we have to send the patient for further investigation of the thyroid gland. Then, the size of the thyroid gland, the numbers of the nodules, the mobility of the enlargement of the thyroid gland, mobility of the diffuse enlargement of the thyroid gland, its of bradycardia or flashing of the face, all of these should be taken into consideration. And then, the thyroid gland sometimes palpable or sometimes non-palpable, and we have to know the size, the location, a large cervical lymph node, whether it is may associated with or possible associated with the thyroid pathology, in addition to the diffuse glandular enlargement, the location, the number of the size of all this nodular enlargement should be demarked well during the clinical examination. إذن examination of the thyroid by itself ما يمكن، بينما نحتاج إلى examination of the cervical lymph node, نحتاج examination of the trachea, نحتاج examination if there is any diffuse or any size or any constant enlargement. All of this should be demonstrating well during the examination of the thyroid. أعتقد لهنا كملت الساعة الأولى. ملخص مفيد، تكلمنا عن الاكسترا اورال اكزامينيشن ووصلنا الى الليف نود اكزامينيشن نكملها بالمحاضرة الأخرى. إذا أكو أي سؤال فيما يخص الاكسترا اورال اكزامينيشن please do not hesitate to ask us. إذا عند أي أحد أي سؤال فيما يخص الاكزامينيشن of the thyroid طلاب، أو examination of the extra oral examination. الو طلاب.
الو
الو
دكتور، موجودين دكتور.
نعم
الو.
دكتور تفضل.
سوري
تفضل
صار لوس
دكتور
اوف
نسمع.
كونتاكت.
مو مشكلة دكتور تمام عادي.
العفو، سجلتوا حضور طلاب؟
اي نعم سجلنا.
سجلتوا.
نعم
الطلاب
دكتور
اللي عنده
سجلنا.
سؤال فيما يخص المحاضرة. أي أحد عنده سؤال فيما يخص الكلام اللي تكلمنا عليه؟ سوري صار لوس اوف كونتاكت. أي سؤال أكو؟ ده سمعوني لو لا؟
اي نعم دكتور موجودين.
إذا أكو أي سؤال فيما يخص المادة. أكو أي سؤال أو استفسار فيما يخص الموضوع طلاب؟ I will be ready to answer any question regarding to our subject. Please do not hesitate to ask any question. اوكي، اللي ما عنده سؤال يقدر يغادر.
شكرا دكتور.
يا اهلا وسهلا اختي، اذا عندكم اي شيء.
عندك مستر.